Hello, everyone. We are just waiting a few moments here to let folks join and get into the webinar mode. Again, we are waiting a few moments to let people join the webinar here. And thank you all for joining us for our first lecture of the Health and Environmental Series of 2022. So again, I'm seeing the numbers pop up here. We will just wait a few more seconds here. Great, so I'm going to get started because we want to get started promptly to give our speaker as much time as possible. So again, this is the Health and Environmental Series by the Wisconsin Environmental Health Network. A quick shout out to our series sponsors. Thank you so much to those folks that make this event happen year after year. So my name is Hannah Mortensen. I am the Executive Director of the Wisconsin Environmental Health Network and Physicians for Social Responsibility Wisconsin. PSR Wisconsin is the fiscal sponsor of WEHN. WEHN is a group of health professionals that connect with environmental organizations and health advocates across the state to work for a safer and a cleaner Wisconsin for all. We try to provide environmental health education, like this series, clinical tools, and provide advocacy opportunities for stronger regulations and protections to protect public health here in Wisconsin. We strive to bring the public health voice to environmental issues every day. So again, thank you all for joining. I want to place some ground rules, some housekeeping. We are in Zoom webinar format. So the panelists are visible tonight. So attendees cannot speak or be seen. So only the panelists are visible. This event is being recorded and will be placed on YouTube for later viewing. And to submit a question, you can use the Q&A feature box, which is at the bottom of your screen. It has two bubbles and is actually named Q&A. Please submit a question at any point in the presentation, or you can wait till the end. We will address as many questions as we can at the end of the presentation, and we'll try to end promptly at 8 p.m. Central Time. If you are calling in, please press *9 to raise a hand, or email us at wehnmail@gmail.com. And then the last housekeeping piece is if you wish to change the view of the presentation and speakers, I just ask that you use an icon and located in the upper right of Zoom, and you can change between gallery view and some other options. And there also should be a slider located vertically in your screen to make the presentation smaller or bigger. And this might be different if you are joining from a phone app. So with that being said, I'm going to turn it over to Dr. Ann Behrmann, our treasurer at WEHN and PSR Wisconsin, who is going to introduce our speaker. Ann, take it away. Ann, you're muted. I automatically muted you earlier.
Yeah, thanks. Good evening, everybody. I don't have to say very much because Hannah's already put it all down, but I was a pediatrician with group health for almost, well, three and a half decades, but at the same time was able to do some work in internationally, particularly in India. And I wanted to say that a heads up to, you saw the sponsors. One of them is Citizens for Safe Water around Badger, and to give I signed to my first professor of environment, Laura Ola, the executive director of CSWAB, who got me involved in doing environmental work as a pediatrician because I had patients who lived near the Badger Army ammunition plant in Baraboo and had water contaminated with volatile organics. And it was Laura and Henry Anderson who really helped me to figure out what I could do for those patients. So it is my great honor to present to you our first speaker of this Health and Environment series, Dr. Vijay Limaye. And I got to know Vijay in 2010 when I was co-teaching a course on India prior to a field term that summer of 2010. And Vijay was in the springtime course 12 years ago. You can read his bio if you want more on the WEHN online website, but he is at present a senior scientist for the National Resources Defense Council. He got his Bachelor of Arts at the University of California, Berkeley, with honors, and then became a joint PhD student here at UW-Madison in epidemiology and environmental resources. His dissertation title was Climate Change Impacts on Population Health, Modeling Exposures to Extreme Heat and Air Pollution in the US and India. And close to my heart, because I've certainly seen the air pollution in India, having worked there in the last 27 years, off and on. But just wanted to say that prior to working with NRDC, Vijay worked even before his PhD with the EPA, and again after receiving his PhD as an environmental scientist. And his role is as an epidemiologist, and his interest is he's broadly interested in looking at international environmental health challenges, but particularly, and I quote him, quantifying, communicating, and reducing the risks associated with climate change, with a focus on the public health burdens of air pollution and extreme heat. And we are so happy to have you, Vijay, as our first speaker. Thanks very much.
There we go. Thank you, Anne. Thank you, Anna. Thank you, WEHN. This is a real honor to be able to join you and share some of our work at NRDC with you today. I also want to acknowledge everybody at UW-Madison, especially my PhD mentor, Jonathan Patz, who's been a real pioneer in the field of climate change and health and certainly shaped my trajectory. And some of the work that we'll talk about today is certainly built on the work of many others at Madison and beyond. So let me just share my screen here. So I've got, let's see, 1 second, sorry. Just making sure. Okay, there we go. Sorry about that. So I have about 40 minutes of remarks today, and then really want to leave plenty of time for a good, robust Q&A with you all. So I'll just dive right into it. As Anne said, I'm a senior scientist at NRDC. Some of you may know us. We're one of the oldest and actually, most effective environmental advocacy groups in the country. We just turned 50 years old in 2020. And NRDC really works at the intersection of science, law, and policy to protect the natural world and environmental conditions on which all life, human and animal life, depends. So I've been working at NRDC for about 4 years, and we'll share some of our work on climate change and health, and particularly costing of some of these health problems related to climate change today, and then zoom out and talk about kind of the bigger picture on this topic. So with that, let's dive right in. I think all of you are familiar with the ways in which climate change is increasingly endangering the health of people all across the country. Right here, this is a map produced by our federal government, folks at NOAA, the National Oceanic and Atmospheric Administration. They're the folks who run the Weather Service. And for the past 4 decades, NOAA has actually been tracking the impacts of the most severe climate and weather disasters across the country. So since 1980, NOAA has been keeping track of all of the types of climate and weather disasters that you see on this map. So this is the total compilation of what hit the country last year, with the asterisk that these are what are called the billion-dollar climate and weather disaster events. So these are the costliest events from an economic perspective. And when we're talking about cost here, we're talking primarily about damage to infrastructure and crops. We're not talking about damages to public health. But that said, here's the map for 2021. I want to note that because my talk is about climate change, the science is strong on various climate impacts represented here, including increasing wildfire risks and stronger coastal storms and stronger storm events inland. However, the science is still evolving on other harms noted here, particularly that extreme winter snap episode in Texas last winter, as well as tornado episodes. And we saw a bunch of those at the tail end of 2021. So I want to just note here that this talk is about climate sensitive health outcomes, but NOAA is tracking both climate and weather phenomena here. So 21, according to NOAA, we had about 20 separate billion-dollar disaster events. The total economic toll of those 20 events was about $145 billion, according to NOAA's total. I do want to note here that while many of these events depicted on the map here are probably familiar to you from just having kept up with the news, a number of relevant climate and health relevant events from last year are not depicted here because the economic damages in terms of property and crops and infrastructure did not rise to $1 billion. Particularly, I'm talking about that extreme heat dome episode out in Oregon and Washington back in June 2021. We'll get into a little bit more detail about that specific event in the talk, but I just want to note that even that $145 billion price tag, while staggering on its own, is likely an underestimate just because of what we're able to adequately track across the country. A few of you may be familiar with what's called the National Climate Assessment. This is a report that's published about every 5 years by the federal government, a bunch of collaborating federal agencies, including EPA, where I used to work, that basically come up with a report to Congress and the nation in terms of the ways in which climate change is affecting the country. The 2018 report, the fourth National Climate Assessment, made a pretty big splash, despite the Trump administration's attempts to bury it on Black Friday, the day after Thanksgiving, because the report really pointed to the mounting costs of the climate crisis for this country. It actually posited that towards the end of the century, the country could be facing billions and billions of dollars each year in climate damages if we don't step up and take actions within this decade to cut greenhouse gas pollution and better prepare communities for climate harms. So it was really this financial and economic framing of climate change that made some headlines in 2018 and continues to be, I think, some useful framing and talking about the costs and benefits of investments in climate action now. Lately, we've had a pretty robust and kind of long debate in this country about Build Back Better and other plans to get our country away from fossil fuels and towards renewable energy. And there's been a lot of talk about how much the climate provisions in Build Back Better and other federal plans from President Biden's team might cost. But lost in that discussion is the billions and billions of dollars that we're already paying for climate sensitive problems right now. And I think just want to share a brief video clip from Secretary John Kerry, former Secretary of State John Kerry, who's the International Climate Envoy for President Biden, who reminded the American press about a year ago now of the mounting economic toll of these climate-related disasters.
It costs a lot more. There are countless economic analyses now that show that it is now cheaper to deal with the crisis of climate than it is to ignore it. We spent $265 billion 2 years ago on three storms, Irma, Harvey, and Maria. Maria destroyed Puerto Rico. Harvey dropped more water on Houston in 5 days than goes over Niagara Falls in a year. And Irma had the first recorded winds at 185 miles an hour for 24 sustained hours. That last year, with one storm, $55 billion. So we're spending the money, folks. We're just not doing it smart. We're not doing it in the way that would actually sustain us for the long term.
So I thought that was a helpful clip because it's sort of, resisting the temptation in our short attention span as a public and reminding us of how much money that we're already paying through FEMA and other federal agencies responding to these disasters to deal with the cleanup and to deal with sometimes irreversible and profound harm to Americans from coast to coast. So here I just want to step back for any of you not familiar with the ways in which climate change is expected to afflict human health in the US and around the world. I want to give another shout out to Jonathan Patz here, who back in 1998 was one of the first to draw attention, especially at the federal level, to the various ways in which the climate problem is expected to worsen human health, both in terms of premature mortality and heightened rates of illness and injury and disease. So just to walk you through this figure on the left side, we have the key environmental drivers of climate change and the changing environmental functions of the world around us. We're talking at this point about an expected increase in temperature, global average somewhere between 2 to 3 degrees C by the end of the century. That's sort of a best guess at this point based on current trajectory. Significant sea level rise and big swings in the hydrologic cycle, the water cycle. So both more extreme and severe drought, as well as more intense precipitation episodes. Those three environmental changes, temperature, sea level rise, and the changing water cycle, are expected to affect different health relevant environmental exposures. And those are represented here in the middle of the chart in the blue box. And so these are all different changing environmental conditions affected by climate change that have real profound implications for human health. We know, for example, at the top of the slide, that the urban heat island effect means that urban areas that are paved over are absorbing more incoming solar radiation, and that is heightening urban core temperatures by a measurable degree and contributing to heat stress, heart failure, other respiratory problems that we'll get into in the case study. Climate change is also expected to worsen air pollution, particularly from ozone smog. That's the ground level ozone that's bad for our health, linked to premature mortality, asthma exacerbations, heightened rates of chronic obstructive pulmonary disease, and other problems. Climate change is also expected to worsen all sorts of other health relevant exposures here. I won't get into a ton of detail. Safe to say the National Climate Assessment, NCA4, if you just Google that, there's a whole chapter on human health that describes each of these problems and the ways in which they're already showing up across the country. So that's, sort of the overview of the ways in which climate change is harming our health. And we have increasingly better understanding from an epidemiology perspective of how these problems are showing up in American hospitals and emergency rooms right now. That said, the field of climate change and health is still astoundingly small. A 2017 analysis by the Lancet Countdown on Climate Change and Health reported that only about 1% of all climate research was devoted to public health ramifications. We're talking about the most profound health emergency that we've faced as a species, and yet we're not devoting the resources that we need to better understand the problem and prepare communities for increasing hazards all around them. So my work is really focused on the financial picture and trying to better understand the ways in which climate change is already doing damage across the country and what that damage means, both in terms of early deaths, hospitalizations, emergency room visits, but also the significant and pretty much ignored financial toll of those health problems. So this is the overall kind of motivating question of my work, is trying to get a better sense of how much climate change is costing public health. I mentioned that NOAA is tracking the costs of climate weather disasters. Unfortunately, the health costs of these problems are pretty much hidden from view. As I mentioned, these cost estimates are primarily confined to things that are insured or repaired and are easier to count, like property damage or infrastructure, crop failure. For a number of reasons, health costs have really seldom been included in these big, national and international assessments of climate impacts. And that's due to a number of reasons that we'll get into the talk, particularly a pretty spotty data picture and a lack of coherence in terms of a method for valuing those health problems in economic terms. So I'll just draw attention to a study that I led and published a little over 2 years ago in the open access journal GeoHealth. It's freely available to download, and I'm really going to walk through some of our key results from the study. Basically, what we did was look across the country at a fairly recent year, 2012 actually, to estimate the ways in which climate-sensitive exposures were already afflicting public health. And we used that year for a number of reasons that I'll get into, but particularly because it's taken, in many cases, years and years for enough literature and public health data reporting to emerge to get a big, better comprehensive sense of the different types of climate-sensitive exposures across the country. What we did is apply a consistent valuation method from state to state to come up with at least some estimate of the financial ramifications of these health problems linked to climate-sensitive events. So I've thrown around this term a lot, climate-sensitive events, and here's what I'm talking about. These are the types of environmental exposures that Jonathan Patz and colleagues drew attention to, almost a quarter century ago. They're the same problems that the National Climate Assessment points to. All sorts of these problems, as I mentioned, in 2021 have hit the country. Back in 2012, the story was pretty much, similar. We had wildfires in the American West. We had an infectious disease outbreak of West Nile virus down south in Texas. We also had continuing ozone smog problems in Nevada and other states across the country. a pretty significant allergenic pollen episode in the Southeast that year, as well as, of course, Superstorm Sandy, which hit not just New Jersey and New York, but a bunch of states out east. The focus of today's talk is really on the Wisconsin experience of extreme heat in July 2012. But I just want to mention that this work is really about kind of drawing attention to the climate-sensitive health effects. So here, we're not talking about climate attribution. We're not talking about a statistical link between climate change and each of these events. I'm not a climate attribution statistician. That science is still evolving, and it's pretty exciting. I'll share some of it with you later in the talk. This is really about bounding our understanding of what the baseline health effects are from these problems, so that if we begin to track them over time, we can get a better sense of how climate change is actually making these types of problems worse. So I don't want to argue here that a problem like Lyme disease, which has existed, for many decades in this country, is solely linked to a warming planet. We do know that a bunch of infectious diseases like West Nile virus and Lyme disease are linked to warming conditions, but also all sorts of complicated ecological and biological mechanisms. So climate sensitivity is kind of a complex concept, but you can think of it as the ways in which climate is linked to health problems, but not attributed yet, because we're still collecting enough data to be able to understand how these health problems are linked to increasing concentrations of global greenhouse gases. So with that caveat, I want to show you, I think year by year, we can lose sight of just how rapidly we're breaking and re-breaking new temperature records across the country. So of course, the last decade was the hottest observed in human record keeping, and 2012 was part of what's been pretty much a relentless march of increasingly problematic and extreme heat episodes across the country. So we saw this map light up with record warm conditions in 2012. Up until that year, this had been the warmest year that the country had experienced. And like I said, it really took 6-7 years for enough epidemiology evidence to emerge for us to do this coast to coast kind of case study approach. So I want to zoom into the state that's near and dear to me and all of you, Wisconsin's 2012 heat wave. Wisconsin has experienced temperature rise of more than 2 degrees Fahrenheit since 1900. And of course, the Badger State is expected to suffer some of those same problems that the National Climate Assessment points out, increasing annual precipitation and extreme precipitation events. Wisconsin really experienced record-setting high temperatures that occurred in other states across the nation. The major heat wave in the state that year was in July, peaking July 4th through 6th, but it was really that first week of July in which numerous daily record max temperatures were tied or broken, as well as new record high minimum temperatures. Record heat, especially at night, is problematic from a health perspective because it's typically the coolest part of the day, the evening, when our bodies can dissipate all the heat that they've accumulated throughout the day and where health problems might be mitigated. But we know that the climate problem is worsening both daytime and nighttime temperatures and making them hotter, which is putting increasing stress on public health. I do want to give a shout out. I see Henry Anderson is in attendance today. Thank you, Henry and colleagues, for publishing a study actually on the health problems that were present as a result of that week-long heat wave in Wisconsin in 2012. Henry and Megan Christensen, a former colleague of mine, and other colleagues published this really careful analysis of the 27 heat-related deaths that were observed during that summer. I just highlighted what to me are some pretty interesting findings from that study, that all of those 27 deaths had at least one or more known risk factors for extreme heat related deaths. Every single one of those deaths was a person who lacked functional residential air conditioning. And the preponderance of those deaths were people who were elderly, above 65 years old. A bunch of them had pre-existing cardiovascular disease, which we know heightens public health risks from extreme heat. And interestingly, mental health conditions were prominent in the case study report. So we relied on public reporting like this from the Wisconsin Department of Health Services and other publicly available data for all of our case studies to really drive our economic costing model. I want to again congratulate Wisconsin for being amongst the states that contribute to what's called the Environmental Public Health Tracking Network. This is an effort to basically track the ways in which environmental exposures are harming human health, not just climate relevant exposures, but all sorts of environmental exposures. I just pulled a screenshot from CDC's public environmental public health tracking network database just to show you where Wisconsin shows up. You'll see the 1,620 emergency department visits related to extreme heat in the state for this heat event. You'll notice here, though, that we don't have every state lit up on this map, right? The Wisconsin case study is really a shining star here because we do not have every state right now reporting environmental public health data in the tracking network. And that's a really big problem, right? Because we do not have a great sense in all 50 states and territories what's happening, right? And so we really need to better invest in state and local public health, and especially in technology and staff to be able to understand even just what's happening from year to year. So just want to give another word of appreciation to the folks at DHS. Thank you. So we have those 27 deaths that were reported in the heat event. We also have the emergency department visits that Wisconsin tracked. The method here is really to attach some economic costing to those types of problems. We know that about 1 in 3 Americans is currently experiencing medical financial hardship, which means that they're basically delaying or completely going necessary medical care because they simply can't afford it. And we know, probably a lot of you know, how expensive and frankly dysfunctional our medical care system is in this country, routinely bankrupting individuals because they simply can't pay. Maybe they can't access employer-sponsored health insurance. Maybe they're not working enough hours in their gig economy job to have that insurance, right? And so when we're talking about the financial costs of these health problems, we're not just talking about the direct medical care you'll see here, but also lost wages people may suffer if they're hospitalized for a number of days and can't attend work. Maybe they're needing to attend to recovery from their health problem. Maybe they have a need for outpatient care or a home healthcare aid. Oftentimes people are prescribed costly prescription medications to cope and recover from a health problem. So we relied on financial costing estimates from what's called HCUP, the Healthcare Cost and Utilization Project. This is a tool developed by the CDC's Agency for Healthcare Research and Quality, AHRQ. That tool allows us to come up with basically apples to apples costing of these types of health problems from state to state. We also, in the upper left, attached economic value to premature mortality. The federal government does this all the time in regulatory impact assessments, attaching about $9.2 million or so to each premature death. That's not saying that each death was actually valued at that amount, but it's an amount that economists and the federal government have kind of agreed to use. The value of a statistical life is what we relied upon because it allows for ready comparison with EPA rules and other regulatory impact assessments. So these are the types of health costs that we looked into using that HCUP database, as well as MEPS, the Medical Expenditure Panel Survey, another database developed by the folks at CDC's AHRQ, the Agency for Healthcare Research and Quality. So I mentioned the public data that we relied on in Wisconsin. I did want to give you a snapshot of about the 36 data sources that we relied on across the case study set outside of Wisconsin. We relied on public data, but I'll talk a little later on in my remarks about the state of affairs on the data side. Just to give you a peek under the hood so that you can have some sense of how we went about things, this is a figure from the GeoHealth paper, just showing you how we connected the health problems in the yellow boxes to economic costing metrics in the blue boxes and the green box to come up with some sense of the health-related costs here. So here, health-related costs captures both the effects of morbidity, illness, and injury, as well as premature mortality. So those deaths in the heat wave and other events across the country. I want to give you a window, and sort of maybe add some color to that figure from Jonathan Patz back in 1998. I mentioned those health problems in that opening slide. This is kind of an expansion of that work and showing you the types of health problems that extreme heat causes, including heat cramps, heat exhaustion, heat fatigue, sunstroke, et cetera. But all of the other climate sensitive health effects that we uncovered through about a year of sifting through the publicly available data. So I do want to note here that we're talking about some harms that are maybe not as widely appreciated, like mental health problems that people suffered after Hurricane Sandy, or air pollution related problems experienced when people were breathing in wildfire smoke out west. So we really were trying to shed light on the whole sort of wide array of health problems linked to climate sensitive events, and we'll zoom in on the Wisconsin results. So here we estimated, using the publicly available data from DHS, the number of emergency department visits and the deaths. We did some imputation to come up with the number of hospital admissions that might have been expected from that number of ED visits, because that wasn't a metric reported by the state. All told, we ended up with about 900 premature deaths, more than 20,000 hospitalizations, and nearly 18,000 emergency room visits linked to our entire case study set. So you see Wisconsin amongst the other states that we looked at here. In terms of costing, in economic valuation and health effects, typically premature mortality drives the preponderance of the total price tag here. And that was definitely the case in Wisconsin. Attaching economic value to those lost lives, we ended up with about $246 million and another $5 million tied to the illness burden from those emergency room and hospitalizations. So we end up with a total price tag in Wisconsin of about $252 million. All told, about a $10 billion price tag linked to these climate sensitive events, with about 8.4 linked to that premature mortality estimate and another 1.6 billion for the morbidity burden. I'll just say that the research on the morbidity side is much younger. A lot of the attention is paid to the premature mortality burden and costing, but we're getting better and better data on morbidity and better able to understand the ways in which these health problems are lingering for days, weeks, sometimes even months after these events occur. In our study, we did try to look into the actual cost burden and who's paying those costs. Overall, we estimated through the available data that Medicare and Medicaid patients, our most vulnerable neighbors, the economically disadvantaged, the very young, very old, are shouldering a disproportionate burden of that $1.6 billion price tag for illness care. That aligns, unfortunately, with the evidence available in the National Climate Assessment that vulnerable groups are being hit first and worst by climate-related health problems. We've been talking since this study was published about 2 years ago with both public and private insurers to draw attention to this problem. These insurance, systems are potentially, facing a tsunami of billing and, financial solvency issues related to climate change. And thus far, it seems like not many of them are paying a whole lot of attention to climate in terms of risk to their bottom line and risk to their patients. So we're trying to wake up the insurance industry, as well as Medicare and Medicaid managers to this problem so we can better address it. On that side, I just want to, of course, draw attention to the policy implications before zooming out a little bit. Of course, I'm from an environmental advocacy group, and I'm going to say, right here that the number one thing we need to do on the climate problem is transition as rapidly as we can away from coal, oil, and gas, fossil fuels that are driving unprecedented changes in the Earth system and huge harm to human life right now, and potentially catastrophic damage to our society. We also, though, at the same time, need to better invest in adaptation. This has been really kind of the ugly stepchild of the climate movement for the past decades. But right now, we do need to make up for lost time and bolster investments in community preparedness to keep people out of harm's way. It's not just mitigation that we need to focus on. We really need to do both at once. I think we need better cost estimates. I led one study. There's been increasing kind of accumulation of these valuation studies, but we do need a more comprehensive look, perhaps led by state and federal government scientists, to better capture this problem and characterize it rather than this case study approach. And I'll touch on the data question in a minute in terms of improved surveillance and tracking. So I think, just to add some context here, ideally, we would be able to come up with an estimate year by year of the total health costs of these types of climate sensitive problems. I'm showing here a map from CCR at the Nelson Institute, showing the changes that we're expecting to see between the long-term average 1981 to 2010 on the left, and 2040 to 2060 in terms of the number of days per year with a maximum temperature above 90 degrees Fahrenheit. So you can see, a lot of Wisconsin is expected to experience, maybe 20, 40, extra days of extreme heat compared to the long-term average. So we really do need to prepare and connect the current kind of case studies and exposure response relationships to our understanding of what the climate models are saying, and try to get ahead of this problem from a public health perspective. We attempted in our study to shed some light on the ways in which that $10 billion figure might be translated to the bigger picture. We used the best data that we could to estimate in the blue bars sort of the fraction of the health burden that we captured in our study in that $10 billion price tag. For problems like hurricanes or West Nile virus, we think we did a fairly good job of at least ascertaining how much of the national problem we captured in our case study set. For extreme heat, we only looked at Wisconsin, and the available data indicates that upwards of 90-95% of the mortality burden was elsewhere across the country. So we need a better kind of bridge to understand the overall fabric of these harms across the country and stitching things together. Towards that end, there's been some good progress lately on the epidemiology side to actually attribute specific heat-related health problems to climate change. So basically thinking of what we call a counterfactual scenario, or what would have happened if we did not have this unprecedented increase in greenhouse gas concentrations around the planet to global temperatures. So this is a figure published in a study released last spring in Nature Climate Change that really points to the ways in which we can really detect how the climate signature is showing up in global temperature patterns. When we connect that to the available health data, we actually can attribute somewhere around 37% of heat-related mortality between 1991 and 2018 actually to greenhouse gas pollution. This is one of the first studies of its kind to attempt to do that climate attribution statistical analysis that I mentioned earlier. And so increasingly, as we drill down to the national, state, and local level, we'll be able to speak with more confidence about the ways in which climate is already linked to specific health problems. I'll say it's a lot easier to do for extreme heat than other more complicated pathways like those experienced in the wake of a hurricane. But this is promising that we're seeing some movement on this front. I do also want to draw attention to the other ways in which we've underestimated the problem, probably in 2012 and certainly in years since. This is just a sample of the heat-related health research that's come out in just the past 6 months or so. I want to give a shout out here to Rachel Licker, fellow Nelson and Sage alum here, who led a study published just last month on the impacts of extreme heat on occupational health and lost wages. I myself am particularly interested in the impact on in the middle left, kidney stones. If any of you, like me, have experienced kidney stones, you know how profoundly scary those can be and painful those can be. There's research out of South Carolina and the ways in which extreme heat exposure is linked to increased incidence of kidney stones, unfortunately. So this slide is just meant to show you that we are still just scratching the surface in terms of being able to understand the physical and mental health harms of extreme heat exposure. And so we hopefully will be able to capture this type of epidemiology and better understanding the problem, and more importantly, keeping people out of harm's way to begin with as we design interventions when we know extreme heat is on the way. All told, big reports like the Lancet Countdown on Climate Change and Health that's released every fall have increasingly drawn attention to this economic gap that we have in national and international assessments. Basically, we are not measuring how much these problems are already costing us. And so as a result, interventions to deal with climate change sound really expensive because we don't have a great understanding of the ways in which climate harms are already fueling tremendous economic damage. So what do we do about it? Me and my colleagues at NRDC, as well as Wendy Max at University of California, San Francisco, published a commentary and analysis in Health Affairs to follow up on our case study approach to basically outline what needs to be done. So I just want to draw attention to this health affairs paper, which is also open access. We came up with a bunch of recommendations to improve the valuation agenda and enable better understanding here. We see this as valuable information for governments, individuals, families, those that are paying for these harms, and also a way to demonstrate that investments in mitigation and adaptation make sense from a cost-benefit approach. Like I said, we need better investment in state and local public health, especially given what we've seen during COVID-19, extraordinary stress on these systems. I just want to mention that right now, I think this is a good wake-up call. The last 2 years, we have seen our government relying on 1980s technology, fax machines, right, to track the spread of a deadly pathogen, the coronavirus. It's, to me, insane, and really we should be ashamed that we've allowed our public health infrastructure to decay to a point where we're relying on fax machines, emailed spreadsheets, recordable CDs to share information. We do not have real-time sharing of public health data in an adequate way on COVID, certainly, and certainly on climate change related health problems. So this is really an area where we need to take advantage of all of the great minds working on tech in this country and make those investments to really deliver a public health data infrastructure that we can all be proud of and that can serve us well. Just on that note, I'll say that increasingly people are paying attention to this data problem. The New York Times, after last summer's extraordinary heat dome out in Oregon and Washington, my brother lives in Portland. He was reporting people retreating to their cars because it was the only place they could access air conditioning. AC prevalence is quite low in the Pacific Northwest, and so we really need to be paying attention to the ways in which we're equipping people to cope with extreme heat. But the New York Times published this analysis in August, so more of a sort of rapid assessment of the hundreds of extra deaths that were observed in those two states. And so increasingly, we're shortening the time between when these events occur and when we're able to actually point to health effects. And I think that shows promise for just pointing out the very real harm that the climate problem is already imposing on people across the country. But like Katherine Hayhoe, a famous climate scientist, says, we need to be talking about climate change more. We need to be talking about the public health ramifications of this problem even more. I've tried to ring the alarm a little bit and welcome collaboration with any of you who are interested in ways to do that. This is an op-ed we published last summer in the Washington Post in the wake of that heat dome and terrible wildfires out west, to draw attention to the public health problems that are often kind of left out of the narrative, oftentimes because we lack hard data. I do think there's also real potential here to localize the climate story. Wisconsin Public Radio picked up on the extreme heat angle of our study, and other local outlets really drew attention to the ways in which the climate problem is already, in many ways, in our own backyards already. So I think this more local approach, rather than these big global or national reports, can help to draw attention and really humanize the problem in people's local communities. We were heartened to see that Governor Evers and his task force on climate change did draw attention to this costing issue in our study back at the end of 2020. And increasingly, I think we're seeing political leaders draw attention to the benefits of investment in climate action to avoid these types of harms from occurring in the future. We've all kind of been suffering through all the coverage about Build Back Better for 9 months or so. Just want to point out that this set of proposals, whether they're broken off from the big bill or not, hold tremendous sort of implication for where we head in terms of the greenhouse gas trajectory for the country. And we can talk more about those investments if you want in the Q&A, but we're talking about $550 billion or so over the next 10 years in investments in mitigation to reduce our reliance on fossil fuels. I just want to wrap up with some closing remarks on teaching and the role of health professionals. I collaborated with Jonathan Patz and 2 others at Madison to really work on another health affairs piece back in 2020, pointing out the ways in which we need to improve our teaching of climate change as a health problem. A lot of students across this country are learning about climate change, but they're not necessarily hearing about the ways in which the climate problem is worsening public health. So if any of you are interested in climate change education and public health, I encourage you to check out this paper, and particularly the 7 kind of key elements that we identified for potentially shaping some teaching on this topic. I see I'm almost done with time here, so I want to draw attention to just one more analysis that we did, not just looking at sort of this case study approach, but all the ways in which interventions, so actions in the transportation, energy and food sectors can deliver savings. This was a commentary we published back in 2020 as well. So particularly speaking to health professionals as trusted messengers for making the case for climate action. Okay, so I'll just wrap up here by pointing out that I think any of you who are paying attention to the news on climate can be dispirited at times, and this can be a tricky, problem to work on, just because it's, it seems so huge and progress seems inadequate. But I like to try to close my talks with a bit of a positive note. This is a picture of New York City back in 1966. It's a picture of Manhattan that's probably, thankfully, unfamiliar to many of you. That's because the Clean Air Act, passed in 1970, has achieved tremendous benefit for air quality across this country, extending lifespan for the average American by about 2 years and delivering economic benefits to the tune of about $2 trillion, according to the Environmental Protection Agency. That outweighs the costs of cleaning up our air by a factor of about 30, actually more than 30 to 1. And, I think the parallel here is clear to climate, that action on the climate change using science, policy, and the law can deliver tremendous savings and benefits to people in this country and around the world, helping us to avoid tremendous harm, sometimes profound, irreversible suffering, and also help us to save money, right? And so this really makes sense from any angle that you look at it. And we really need to be paying attention to all of that missing math that isn't part of the climate cost discussion. So I think we have a roadmap, and we need to set forth with a big ambition to achieve it. With that, I'll just wrap up. I really welcome your attention to this topic, and I think we've got some Q&A already teed up. Here's my contact information. I welcome any of you reaching out to me, and feel free to give me a follow on Twitter. Thank you.
Wonderful. Thank you so much. I wish we had a whole audience to give you a round of applause. Thank you so much. I did, for folks, the attendees, I did try to keep up with the studies and linking them in the chat. There are a few at the very end that I didn't get to, but I'll try to send those out in the email that I'll be sending in the next week with the recording of this presentation, so we can link some of those studies that were mentioned in the presentation, so it's easy for you to view. So again, we're going to start with Q&A. I'm just going to start from the top. Anne and I will be alternating, and again, you can submit that through the Q&A box at the bottom of your screen. And so I'm going to start right off the bat here. If you're good to go, Dr. Limaye.
Sure.
Okay. How could you see healthcare professionals helping with data collection or tracking?
Oh, this is a great question. So I didn't mention that our study really relied on adequate coding of public health problems, what's called the International Classification of Disease, ICD codes. These are the codes that medical professionals are using oftentimes in billing to really relate what happened in terms of them delivering care. Unfortunately, that ICD system is not shaped around really concentrating around climate sensitive health problems. So I think I'm actually engaged in an effort and welcome help to try to identify kind of the families of ICD codes that are relevant from a climate perspective. If we have better coding from the health professionals, we're better able to capture the actual incidents and the counts of these harms. But unfortunately, we don't right now have enough physicians being trained to recognize the linkages. If someone is experiencing carbon monoxide poisoning after a storm event, they may not necessarily code that in the right way that allows health researchers focused on climate like me to actually get at that data. So I think there's a lot to be done on that front, and I welcome anyone interested in the coding issue to get in touch, because that's really key.
Thanks, Vijay. Second question is from Susan King. What efforts have been made to identify cost impacts on municipal and state governments attributable to heat island effects or heat waves?
Yeah, thankfully we've seen some more attention on this particular question lately. I'm thinking particularly of a new report that came out just last month for the city of Phoenix in Arizona that was pointing to the load and the burden on municipal government from extreme heat experienced in that region over the years. So I think increasingly we have a better understanding of kind of the local, just human staffing considerations, the workforce issues, and more kind of a focus on municipal level impacts. So I'm happy to share that report, Susan, if you share your email, and maybe a few others come to mind. But I'd say, overall, we don't have adequate staffing on this front to really kind of do the retrospective look at these events and do some costing.
I'm going to try to pronounce this right. I will say I am not a health professional. I'm a nonprofit person. Have prophylactic recommendations been made for athletes in extreme heat, especially high school athletes?
Oh, yeah. Thank you for that question. I am familiar. I'm part of the American Meteorological Society, AMS board on environment and health, and part of our work is actually with athletic groups and health scientists working on athlete related heat. So I am familiar with some of those recommendations, and I'm happy to dig up and share some context with you. Unfortunately, sorry, that's a little bit out of my area of expertise, but I do know a few people who are working on that, and I'm happy to connect you, John.
Here's another question from Jed Downs. That's a comment and a question. My understanding is that the Texas cold snap was related to weakening of the jet stream due to lack of difference in temperatures between the tropics and the Arctic. Is that premature?
Yeah, that's my understanding too, that we have this kind of, I think it's, actually linked to the same kind of polar vortex phenomenon that a lot of us in this part of the nation have experienced in the last decade or so. I do think that's the emerging consensus. We have been pretty, careful not to go out front and be linking those, last year's episode or other extreme cold snaps to the climate problem. But I think you're right, John. That's what I've read too, that it does seem to be sort of a mechanism that's plausible.
Okay, we have one from Susan King. As a former plan commissioner, I am curious about examples of successful coalitions to raise the awareness of municipal officials, administrators, and developers to address urban heat island effects and updating codes, building, and landscaping practices. So I think her question is if you are aware of any successful places that raise the awareness of heat island and urban heat effects for cities.
Yeah, some of the work that WEHN for Environmental Justice out in New York City has been leading on the municipal action front, particularly as it relates to building codes in low-income housing, I think have been pretty fruitful. We at NRDC have been collaborating with WEHN for over a decade or so, and published a few science studies pointing to inequitable heat island and temperature burdens on low-income housing residents. And so I'm happy to share that work with you. And I do think increasingly paying attention to folks like renters and making sure that landlords are responsive to heat-related health concerns is important. And increasingly, we're at NRDC advocating for building codes, occupational safety standards, trying to get the climate kind of health protection argument not just within the environmental public health space, but also within housing and transportation, et cetera.
Thanks, Vijay. I just was going to put in a word for people to look at the work that you have done and other people have done in India, in Gujarat, because we think about heat islands in Wisconsin and we really suffer when it's 90 degrees, and I don't have air conditioning in my house either, but I have been in India where it's 42 or 43 degrees centigrade, and you can understand that people living on the street, not only do they not have air conditioning, they don't have housing, and there's a lot of simple things like painting roofs white or putting white tile on the roof. I mean, some easy things that people should look at to say that this problem is not all huge technology. There's some pretty simple things that are being done in cities around the world. And I wanted to tell people, look at some of the great things that NRDC has put out, and Vijay, you've been part of to look at that.
Thank you, Ann. Yeah,
Sure.
thanks. Yeah, the low cost interventions, land cover interventions, cool roofs, urban greening, yeah, can be hugely cost beneficial. And yeah, they do, the science indicates they're definitely making a dent in extreme heat exposures and also electricity demand.
So anonymous attendee, any suggestions as to where we can most effectively impact climate policy?
Yeah, I think there's kind of this always whirling debate about individual action versus structural change. And the truth is that we're in such a hole now that we really do need action on both fronts. So, for me, as someone who works on the climate problem day to day, I do think it's true that we, it can be uncomfortable, but we need to be talking about the ways in which, especially, Americans have, contributed a really gigantic share to the accumulation of climate pollution. And the ways in which we can use our privilege in this country, both through voting, but also through our spending, also through our education systems, also in the ways in which we advocate for preparedness in our communities. If any of you were in Madison back in 2018 and experienced that unprecedented flooding in August and September, how much this climate problem can really tremendously disrupt daily life, right? And so if you look at just what the science indicates, we are headed in the wrong direction on this front. And as disruptive as it's been in the past, it's poised to be even more destructive and disruptive in the future. So I think, talk about the climate problem, taking individual action and advocating for systemic change and not letting up, taking a breather when you need a mental health break on this, but recognizing that the other side is well-funded and has been fueling disinformation on this issue for decades and decades. So we really need a people-powered coalition, I think, and we really need to be outraged about the tremendous harm and peril in which we are all placed and future generations are increasingly facing.
Thank you for your perspective on that. This person has a few compliments for you, so I'm going to let you read those.
Okay.
But they read an article on BBC regarding lithium mining for batteries. Only 5% of lithium batteries apparently can be recycled, and the mining in Chile and in the desert has already caused hotter days and poorer air quality in those communities. Is this alternative to fossil fuels being discussed, and the ramifications of lithium mining on those communities?
Oh, wow. What a question. I have read a little bit about the lithium problem, and I know that we have folks on our international team working on those technology questions and EV batteries and all that. So I'm happy to connect you with some colleagues who can better articulate an answer there. I will point out, you pointed out in the question, the link between extreme heat and air pollution. We know that the hottest days are when ozone smog spikes around this country. And increasingly, we understand that there's an interaction effect. So it's not 1 + 1 = 2, but it's 1 + 1 = 10, potentially, in terms of the accumulation of harm from different stressors on the human body. So just want to draw attention to the air pollution issue because it's sometimes ignored.
So question from another anonymous attendee. What are you currently working on, and what do you have for upcoming studies?
Yeah, so we're working on trying to make the case and really equip medical professionals with the toolkit on the coding question that came up earlier. Internationally, we're also working on articulating the tremendous air quality, climate, and health benefits of climate action in Indian cities, which experience, like Anne mentioned, air pollution that's often off the charts when we think about the problems with pollution that we face in this country. So, increasingly, we're kind of trying to keep the ball rolling on the valuation stuff and hopefully, getting to more of a national and picture on that. I, encourage you all to check out the 5th National Climate Assessment, which the federal government is currently engaged in. Public outreach is active for that project, and that's really where we're going to see, I think, again, more of a focus on the ways in which this problem is already very much showing up around the country. So check out NCA 5. If you just Google that, you'll find it.
Great, thank you. We're just about at 8 o'clock, so I feel like this is a great point. We have a final question from Mr. Henry Anderson. Have you done any communication effectiveness evaluations on the use case studies versus other science approaches?
Thanks for the question, Henry. I myself have not done those types of studies. I have increasingly been looking into the risk communication kind of literature to understand about, unfortunately, Henry knows, but some of you may know that, people in the US don't necessarily appreciate extreme heat as a health problem, right? They see it as an inconvenience, maybe something that's going to cost them more in an air conditioning bill. But they don't understand the dozens of ways in which extreme heat stresses the organ systems of our bodies, our brains, our lungs, our hearts, our kidneys, and can actually be deadly, right? And so I think we need to be more explicit about those mechanisms and, take advantage of, I showed you half a dozen studies just from the past few months on extreme heat and talk about, if you've experienced a kidney stone, you never want to have one again, I assure you. And so I think just, humanizing this problem and being specific about the mechanisms can get us, some way on that challenge.
Well, I just want to, thank you, Vijay, so much for sharing your knowledge tonight with us. We definitely appreciate your presentation. As someone said, it had excellent flow, graphics, so much data, but yet you communicated it very well. And again, to all the attendees, I will be sending out a follow-up email in the next week with the recording and as many links as I can to the studies mentioned. And again, I want to mention that you all can go to our website, wehnonline.org, to learn more about our organization and how you can get involved. And to mention that we still have 3 more presentations left in our series. So please, you are already registered. Use this exact same link for the other presentations, the exact same link. And we hope to see you all at those other presentations. And again, thank you, Anne, for joining and helping me. And again, thank you, Vijay. Do you have any last remarks before I close it out?
Thank you all.
Thank you.
Thank you.
Thanks, Vijay. Bye-bye,
Everyone, have a good night. Bye-bye.